Hey folks, Blair Shackley from Nose Creek Sport Physiotherapy. Well, we're going to do a little bit of a quick video presentation on two key hip muscles that we need to strengthen up after you've had either a knee or a hip injury. And so the start of the first one is basically what we call a clamshell. So imagine if you're up against a wall, your back's flat on the wall, your knees are bent to 90 degrees, and your thigh angle is about 45 degrees down. Your heels would touch the wall, okay? You're gonna draw your belly button up and in, have your hand on your pelvis here, you can have your other hand supporting your head, and just literally lift up into an externally rotated position, and then down slow. So you can go up quick, hold, and then it's 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5 on the way down. I'll just repeat again, up, hold, and then 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5. You'll feel that right in behind your hip bone. That's where your deep rotators are, okay? So we call it the clamshell because your legs are opening almost like a clamshell would, essentially, okay? The next one is called the hip abductor. All we do for that one is we keep our lower leg in the same position. The top leg goes straight. We're gonna toe down that foot and we're gonna lift up the foot, hold for a second, and then down slow. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5. And then lift up again, hold, and then 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5. Just like that. And that's level 1 hip exercises. Now, after you start with 3 sets of 10, and then every week you want to add 5 repetition, your goal is to get to 3 sets of 20. If at 3 sets of 20 gets easy, that's when you want to tell us, your therapist, that hey, that's easy. Then we want to move you on to level 2. Now level 2 is basically for the clamshell. We straighten out the bottom leg now, we rotate our trunk 45 degrees forward, and a good landmark is if your elbow's at 90, your top shoulder should actually touch your hand. You place this hand on the floor of the bed so that you got good stability. You're gonna draw your belly button up and in. As far as landmarks down here as well, the bone that your belt sits on, you wanna be right on top of that. Your belly button should almost touch the floor there. And then you're gonna draw that leg up, hold, and then down slow. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5. And then again, up, hold, 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5. It's a smaller range of motion, but it's more the outer range, which will really fatigue those deep rotators. And again, you'll feel it right in behind the hip bone if you're doing it right, okay? And for some of you that are in pretty good shape, you might find that I don't feel anything. Keep going. Within about 5 or 6 reps, you're gonna start to feel that muscle right in behind your hip bone there. So again, up, hold, and then down slow. 1, 2, 3, 4, 5. Make sure you tighten up your core so you're not kind of rotating like this. So if your trunk is moving, it's time to switch sides because that muscle's pooped out. So really draw the belly button up and in, stabilize the spine, and then lift up. And for males doing this exercise, the joke we always say is that imagine your male dog peeing on a fire hydrant. And for most guys, they can visualize that, and then they realize that it's just a pure rotation of their hip. All right, good. So that's the level 2 clamshell. I'm gonna stop just for a sec, and I'm gonna get up and I'm gonna show you how to do the hip abduction with the tube now. So I'm just going to transition to that position.